How safe is the air we breathe indoors? It's an important question to ask for places like restaurants, gyms, and the office as this Delta variant continues to spread. So how concerned should we all be? Our investigative reporter Joel Grover tonight reports.
Is this supposed to simulate an actual cough? The secret solution in this spray bottle can tell you if the air in your office is more susceptible to the COVID-19 virus.
It's intended to simulate a cough or a sneeze.
It's now well documented that droplets from a cough or sneeze can spread viruses like the one that causes COVID-19, which can stay in the air for 30 minutes to hours and travel well beyond 6 feet, according to peer-reviewed articles like this one by the head of the Healthy Buildings Program at the Harvard T.H. Chan School of Public Health, Professor Joseph Allen.
One of the biggest surprises of the entire pandemic is that there's been a failure to recognize the reality of airborne transmission.
To find out the risk firsthand, the I-Team recently traveled to the Bay Area laboratory and headquarters of Safe Traces to see for the first time how this company is testing the safety of indoor air that we all breathe. The company has now been used by some of the biggest landlords in California, like the Irvine Company, and by public entities like the Dallas-Fort Worth Airport to test their air using the solution in this spray bottle.
This looks like a bottle of air freshener.
And some sophisticated machines.
We pioneered it, yeah.
We spoke with CEO Eric Malmstrom before an indoor mask mandate went back into effect in certain parts of the state.
Most employees won't really know if the air quality is good in their building, right?
No, they won't.
To test the air, Safe Traces technicians spray a harmless DNA solution. Then they capture air samples, which are analyzed for the amount of virus-like particles. What they measure is something called air change, the number of times the air in a room is changed every hour. Changing the air is often important because studies show with the virus that causes COVID, the majority of outbreaks involving 3 or more people have been linked to airborne transmission.
If the air isn't changed often enough in an office setting, could people get sick?
Yes.
The I-Team discovered that no government agency has yet set clear standards for air changes in a room. But the Harvard School of Public Health has determined there should be at least 4 complete air changes in a room every hour, ideally 6 changes, to prevent the spread of infectious viruses.
That means that you're changing out air 6 times an hour or every 10 minutes, and through the combination of ventilation and filtration.
In high-risk settings like hospital operating rooms, the air is changed out completely 12 times an hour, according to this Department of Defense study. On commercial airplanes, up to 36 times an hour, more than once every 3 minutes. But those places are the exception.
For example, in your home, you typically get half an air change per hour. In a school, we get less than 3 air changes per hour.
When Safe Traces tested the air in its own conference room, it found the air was only being changed out 3 times an hour, not the recommended 6.
Were you satisfied with 3 air exchanges an hour?
We don't think that's enough.
But improving the number of air changes in a room or building is not necessarily expensive.
Really is quite simple. Opening up the windows a bit, or purchasing one of these portable air cleaners with a HEPA filter.
HEPA filters that you can buy inexpensively online or at a hardware store. When Safe Traces put this HEPA filter in its conference room, the air went from being changed 3 times an hour to 10 times an hour. It's something any workplace can do.
If I'm going back to the office for the first time in a year and a half, what do I want to ask my employer about the air?
What have you done to make the space safer? Where is the ventilation and filtration system today? People should be transparent at this point. It's people's health and safety and lives that are at stake.
If you want to use a HEPA filter in your office or workspace, public health experts say it's important that it's powerful enough to change out the air in a specific room. To help you figure that out, we've put some important information on our website, NBCLA.com. For the I-Team, I'm Joel Grover.